In this video, I want to explain how we approach working with pregnant moms. Because since 2005, since my wife and I got out of chiropractic school in 2005, we've been practicing what's called the Webster technique, which is specific for pregnancy. And we've seen many pregnant patients throughout the years. Some patients come in with their child in a breech presentation. Some patients come in at the very start of their pregnancy and they get care throughout their entire pregnancy. What we actually recommend is what would be the best and the most ideal situation is to start from the very beginning, even before conception. Start to make sure everything is aligned properly. That way, as you grow, everyone knows as you're pregnant, there's going to be more forces on your spine, more forces on your body that your body might not be used to. And as the baby grows, as your posture changes, it puts a lot of stress, puts a lot of postural changes on your low back and your pelvis and your sacrum area. So one technique that we focus on is the Webster technique. The Webster technique mainly focuses on aligning the pelvis so that there's ligaments attached to the pelvis that go and attach to the uterus. Because if the pelvis is misaligned, if things are shifted out of alignment, I'm going to show you here on this spine. So this is looking right at the spine here, and this is the pelvic bowl in the bottom, and this backbone right here is the sacrum. There's ligaments connected to either side of the sacrum that go right out and connect to the uterus. They're called sacro-uterine ligaments. And a good way, a good visual, a good way of thinking of the uterus, think of it as a balloon that sits right out here. As the baby grows, it gets larger and larger and larger, and those ligaments are attached to the uterus to help keep the uterus in place. Now, if your sacrum or your pelvis is shifted out of alignment, if it's shifted backwards on one side and locked up, then what's going to happen is that's going to pull on those ligaments that also pull and torque on the uterus. And that also makes it so the birth canal, you don't have as much opening in the birth canal, so it can cause more problems during the birth process. So our goal is to help identify which side is locked up, which side is not aligned properly. And there's a specific way of doing that with the Webster technique. It's very gentle and very easy to do. But once we identify that, we make an adjustment to help realign the sacrum, realign the pelvis, so that way the birth canal, you have maximum opening for the birth canal, and you also you take that tension off the ligaments from the sacrum out to the uterus. You take tension off that, which helps the uterus get in the optimum alignment, so the baby has the optimum space to be able to turn and move around. Once that is worked with, a lot of times women will have what's called the round ligament pain. Round ligament is a ligament that connects to the front on either side, both sides of the uterus, on the front side. It connects to the front of the uterus and it comes down and connects right to the side where the pubic bone is here. And a lot of women will actually have pain in that area because it's a very unique ligament. It's a ligament that actually has muscle fibers with it. So when your pelvis is shifted out of alignment, the sacro-uterine ligaments pull. They can torque the uterus, and then usually on the opposite side of that, the round ligaments will be tightened and spasm. So we can work to help relieve all of those things. That can help the pelvis get in the optimal alignment, birth canal have the best opening possible, to help give you the best pregnancy possible and the best outcomes for your birth as well. It has been our experience that with patients with breech presentation, this is one of the best techniques to help the baby get into the right alignment, the right position. We've had over 80 to 85% success rate with pregnant moms, with the babies getting into the right position so they can actually have that natural childbirth that they're looking for. So whether it's something that you're looking for to have care throughout your pregnancy to help the whole pregnancy and the birth go as smooth as possible, or if you need to work with a breech presentation, you can either email us, you can give us a call, or you can set up an exam. We can check everything out for you. But I hope that helps you understand why we work with pregnancy, because it's such a valuable thing to offer pregnant moms because they don't have a lot of options. Again, you don't want to take a lot of medications. There's not a lot of things that you can do while you're pregnant because it all affects the baby, it affects your unborn child. And so it's a great thing to offer, and we have just a huge joy working with pregnant moms. So if you have any questions, let us know. But I hope this helps, and we'll talk to you soon.